there's two groups of people that should be taking Kyani's products, especially Nitro Effects and Nitro Extreme. Young, healthy people in order to stay healthy, so they don't get sore shoulders and bad knees and sore backs. And those with, excuse me, with ailments or diseases that we all get as we get older. The very first thing that you have to know about Nitro Effects and Nitro Extreme produce in the body something called nitric oxide, and it is in fact, the most powerful vasodilator that God has given us. Vasodilation means nothing more than an increase in blood flow. Sometimes we just don't produce enough of it, or the body, through diseases, destroys it faster than we otherwise should. So vasodilation is good. It lowers blood pressure. A lot of new research has found that increased nitric oxide can maintain healthy blood pressure, can prevent or delay heart disease. If I increase blood flow through Kyani's products, what else might happen? Drugs like antibiotics, vitamins, antioxidants, trace minerals, drugs for people that have had kidney transplants, women getting or men getting chemotherapy for cancer. All of these products will get to the tissues more easily if the blood flow is good. It turns out that nitric oxide inhibits the replication, the multiplication of the HIV virus. It turns out that not only does nitric oxide inhibit the replication of the HIV virus, but it stops the replication of any virus that's ever been studied, including the one that gives you the common cold. That serum nitric oxide significantly lowers blood glucose in people with diabetes. A diabetic is going to suffer at some point in his and her life with eye problems. We call that retinopathy. They actually can go blind. Or heart disease, coronary artery disease. They may lose their kidneys eventually. Often, the blood flow to the lower legs gets so bad that a wound develops which can't be healed very well, and it's all because the blood flow is very low. Even the antibiotics given for the wound treatment don't get to the wound itself, and an amputation results. If you could stop that process by improving blood flow with a simple supplement. Why is nitric oxide so important for people with diabetes? Because diabetes decreases blood flow. Nitric oxide increases blood flow so there's less injury to these organs, these four important organs. Nitric oxide is actually produced by insulin. And once that happens, glucose moves out of the blood and into the cells. So if insulin produces nitric oxide, and Kyani's Nitro Effects produces nitric oxide, and they both cause lowering of blood sugar, this is the way that nitric oxide should help lower blood sugar without the need to resort to those drugs that diabetic patients have to take all the time. That poor blood flow to the skin can lead to wounds that are difficult to heal. If the wound gets infected, it may require an amputation. Who wants to live with only one foot or one leg? And this is just an example of how nitric oxide can help with healing. That on the right-hand side is a movie that shows the rate and quality of healing. And at the very end, this poor gentleman whose ulcer healed in just 4 months after being there for 40 years, he ended up with his leg looking like this. No scar tissue. No scar tissue after the wound was healed with a 5-month daily treatment of Nitro Effects. Those women who have had cancer chemotherapy many times lose their hair. I've seen remarkable improvement in hair regrowth as well as the thickness and quality of the hair in people that have taken nitric oxide supplements. The amount of blood flowing into the brain appears to be closely linked to the development of dementia. caused by conditions such as Alzheimer's disease. What is he saying? Blood flow to the brain in an Alzheimer's patient is about 50% of normal. A new study has shown that older adults with dementia had significantly reduced blood flow in the brain compared to older adults with normal brain function or young adults. Young adults have normal blood flow to their brains. Over time, some of those young adults might eventually have this decrease in blood flow and start to develop the signs of early dementia, early Alzheimer's disease. Pain goes away if the nerves that normally receive oxygen are not getting enough oxygen, are getting the oxygen that they need. If you've got good blood flow, vasodilation, more oxygen, you will have less pain. The way morphine works, which are given to people with severe pain, the way those narcotics work is through nitric oxide release. FX and Extreme produce nitric oxide and get pain relief. Morphine produces nitric oxide and you get pain relief. Nitric oxide produced in small amounts can bring dramatic relief to people with painful osteoarthritis. Many of you have heard of some disease called fibromyalgia. Fibromyalgia is a painful condition, and it's all due to abnormal or poor microcirculation. There's a disease called Raynaud's. It's sort of like frostbite. Your fingers and toes are so cold, you just can't get them warm. There's no way. It turns out that if you increase nitric oxide, you improve the blood flow to the fingers in the skin of patients with Raynaud's. And this was a study done more than 10 years ago. The Lancet, Lancet, is the most prestigious medical journal in the world. Look, wounds are painful. Anything that cuts your skin, that's painful. Tissue damage of any kind, the shoulder problem that Stefan talked about, Mike's sciatica, tissue damage is painful. There are two other situations where pain contributes to poor quality of life. One is diabetes, and the other is chemotherapy. Nitric oxide also enhances the immune system. Nitric oxide is used by your body and mine, by the white cells in our body, to kill bacteria. I've already talked about viruses. Nitric oxide regulates the number and the activity of those cells that fight off infections and viruses. You need nitric oxide every day, not only to keep up blood flow to the coronary arteries so you don't get grandma's anginal pain, or you don't get the flu in February. You need it every day because we're challenged all the time by bacteria and infections. Nitric oxide modulates fracture healing, modulates tendon healing, snoring, sleep apnea, COPD, emphysema. Check the research. Nitric oxide production is decreased in people that have snoring problems, have sleep apnea, have emphysema, and have chronic obstructive pulmonary disease, COPD. COPD patients have so little nitric oxide that they can't get air into their lungs normally, and they have to wear a mask, which is shown here on this slide, at night for 8 hours, just to force air through their nose into their lungs. What if they took NitroFX and NitroExtreme? And we are now engaged in a study at Harvard on COPD and sleep apnea patients using methods to increase nitric oxide. When should I take it? I do a lot of workouts to try to keep myself healthy. You can take it either during your workout or just before. That'll help keep blood flowing and allow you to have longer workouts without hitting the wall. You'll get less lactic acidosis if you exercise, if you take it before or during your activities. If you take it just after you've exercised and worked out, you'll get a quicker return to all your body functions, quicker recovery really. Can you get too much nitric oxide production? No. The answer is no. The answer is no.